all you're left with is a scarred, liver-shaped coral bed. From there, it can go even further to end-stage liver disease and/or hepatic cancer. Watch the cirrhosis video for more info. If enough of the liver is affected to prevent effective clearance of normal metabolites like ammonia, a liver transplant may be the only option. Unfortunately, many of these patients won't even qualify for transplantation because they aren't able to overcome their addiction to alcohol. Do keep in mind that the liver doesn't always follow these phases strictly, and that not all heavy drinkers will progress to the end, even if they continue to abuse alcohol. The liver is a hardy organ, and as a rule of thumb, it takes about 20 years of heavy drinking to turn a liver cirrhotic. All right, it's time to change gears and focus on the other Mallory sister. She's the good sister, whose only vice is the occasional pastry. Or 5. That's right. Over on the right, we're alcohol-free. Distinct from alcoholic fatty liver disease is an increasingly common syndrome aptly named non-alcoholic fatty liver disease. And it encompasses the same spectrum of disease as before. There's fatty liver, also called steatosis. Then we've got steatohepatitis, when inflammatory changes can be seen. And lastly, cirrhosis, which is largely irreversible. And this is all happening in a patient who doesn't drink, or at most, drinks in moderation. The terminology is just a bit different this time. When only fatty changes are seen in the liver, remember those microvesicular and macrovesicular fat globule polka dots? This is called non-alcoholic fatty liver disease, abbreviated NAFLD. The pathogenesis of NAFLD is still unclear, but likely related to increased visceral adipose tissue. So we've added on a few extra pounds to the Mallory sister on the right, in case you haven't noticed. Increased adipose tissue leads to insulin resistance and altered fatty acid metabolism, not to mention more free fatty acids floating around. In the end, the liver holds on to more fat. When hepatitis sets in, along with some of the clinical features we described earlier, such as elevated liver enzymes, it's called non-alcoholic steatohepatitis, or NASH. Histologically, this condition is nearly identical to alcoholic hepatitis. So expect to see neutrophil infiltration, Mallory bodies, and ballooning of hepatocytes. Why the sudden onset of inflammation? Again, we're not really sure. It probably has to do with fatty hepatocytes being sensitive to excessive oxidative damage, leading to apoptosis. One of the major conditions associated with progression of disease is the metabolic syndrome, which is defined as having at least 2 of the following: obesity, insulin resistance, dyslipidemia, and hypertension. These are all risk factors for disease progression. In other words, a patient with features of metabolic syndrome is more likely to progress from NAFLD to NASH to liver fibrosis. Hard to resist those metabolic brownies, though. So good. NASH is generally asymptomatic, but can present with right upper quadrant pain or malaise. On labs, look for elevated liver enzymes. In fact, in recent years, NASH has become the most common cause of incidentally discovered elevated transaminases in the U.S. Remember, though, ALT and AST will be elevated, but not as high as that seen with alcoholic hepatitis. And if the values are significantly increased, usually it's ALT that's higher than AST, hence the ALT malt glass getting lifted in the air. While the progression of NASH to cirrhosis is rare, with the increasing prevalence of NASH, it's become one of the most common causes of cirrhosis and hepatocellular carcinoma in the U.S. For now, emphasis on reversal that led to fatty liver. Prescription is exercise, treatment of associated such as obesity, diabetes, and as the prevalence of obesity syndrome increases in pediatric population, NASH is becoming as well. We're going to finish up this sketch with a unique but deadly cause of steatohepatitis in children, syndrome. In the 1970s, a series of studies showed children with unusual neurological symptoms with aspirin and influenza. By the 1980s, the link between syndrome was so strong that the FDA issued a warning of salicylate containing children with pox. On the bottle today is now exceeding. The prototypical syndrome is a young, typically less than who takes aspirin or right after or an upper respiratory thing, in other words, are recurring viral sick at the child goes post-infectious syndrome. 1. Encephalopathy. 2. Particular fatty changes in the liver. 3. Serum elevation. Recall from sketchy aspirin is our ASA. In this scene, a better way to drinking with a encephalopathy. Wondering how aspirin and why it's kids and viruses. Well, bring that too. The pathogenesis of the disease is unclear, but it's believed and solicitates somehow induce damage. Do know how the disorder works. Mitochondria are responsible for beta acid, and this becomes fatty acid primarily with inflammation, transaminase damage. Interestingly, it does not show an inflammatory inflammation. Instead, we see microvesicular changes in which globules of fat have cytoplasmites, as evoked by the small beads of water circulating on the liver mat. Contrast this to vesicular fat we saw earlier with alcoholic steatosis and so much fat entire hepatocyte nucleus to the side, to elevated ALT, but not the 2-to-1 with alcohol. Why we see fatty liver and transaminase, but why the apathy in the triad? Well, remember that the theory is that the mitochondria are injured. Part of the urea cycle takes place in the mitochondria, and without this cycle, ammonia cannot be metabolized. As a result, blood levels of ammonia rise. Initially with Rey syndrome, all you might see is a sleepy baby who's showing regression of motor development, i.e. being more clumsy than usual. At this stage, hepatomegaly and liver dysfunction are already present. But due to the nature of the symptoms, as well as the typical age of those affected, a parent might not realize something is wrong. As ammonia levels rise and cerebral edema develops, signs of frank encephalopathy begin to occur. The initially sleepy child can develop seizures, vomiting, and upper motor neuron signs, like clonus, spasticity, positive Babinski. Left untreated, Rey syndrome can progress to coma and death. Death can occur in anywhere from 25 to 50% of all cases of Rey syndrome, despite treatment. So our solution to Rey syndrome seems to be just don't give aspirin to young kids with viral infections. All right, Mallory sisters probably weren't the first choice for billing in the lounge. So let's end the auditory assault with a quick sum up. While there are many causes of liver disease, there are 3 important here: alcoholic liver disease, NAFLD, and Rey syndrome. And remember, the liver doesn't always follow these phases strictly, but a good way to think about the progression of disease is steatosis, reversible, to steatohepatitis, semi-reversible, to fibrosis and cirrhosis, not so reversible. When hepatocytes break down alcohol, it leads to depletion of NAD and shutdown of fatty acid breakdown. This leads to fatty acid accumulation and both micro and macrovesicular fatty change on histology. If it progresses to alcoholic steatohepatitis, Mallory bodies, ballooning degeneration, neutrophilic inflammation, and fibrosis all join the party. And from where? Zone 3 lobules, of course. The most susceptible to ischemic and metabolic damage. While fatty change can be asymptomatic for years, acute alcoholic hepatitis presents with tender hepatomegaly, fever, and possible acute encephalopathy. Key lab findings in alcoholic hepatitis include elevated GGT, but most importantly, transaminitis with an AST-ALT ratio greater than 2. A toast to AST. If alcohol exposure continues, fibrosis can become irreversible, and cirrhosis can develop. While the pathogenesis of NAFLD isn't entirely understood, it has a strong association with obesity, poor diet, and especially metabolic syndrome. On histology, NASH has the same features as alcoholic hepatitis: Mallory bodies, ballooning degeneration, neutrophilic inflammation, and fibrosis, all starting in Zone 3. While they don't need to knock off the sauce, they do need to work on all the features of metabolic syndrome, or just like alcohol, cirrhosis can ensue. Remember, child plus viral illness plus aspirin equals all bad. Salicylates and viral illness in children cause mitochondrial damage and decoupling. On histology, these kids have microvesicular fatty change without inflammation. They'll also have an ALT predominant transaminitis, and since the urea cycle is shut off, elevated ammonia. This leads to the progression from sleepy baby to encephalopathic baby to seizing baby with central edema. It's no coincidence that both alcohol and NAFLD lead to cirrhosis, a liver turned to stone. And cirrhosis is one of the most important risk factors for hepatocellular carcinoma. So let's head over to the next sketch for the headlining act: liver tumors.